Good evening, everybody. Thank you very much for the opportunity to talk to you about our project up in Derby that investigates what the virus, human papillomavirus, that has been so well introduced to you already this evening, is doing in the head and neck. So, HPVs are small DNA viruses. They cause warts and verrucas. But if you are unlucky enough to have a persistent, high-risk infection, then that is a risk for cancer. And has already been suggested to you, we know that as cervical cancer, HPV is the causative agent of cervical cancer. But as you can see on this tiny graph here, that incidence of cervical cancer is falling. This is the UK and the US data. But at the same time, we're seeing a drive, an increase in the number of head and neck cancers caused by this virus. And in fact, we now have that incidence of head and neck cancer caused by HPV having overtaken that of cervical cancer. The prevalence of HPV, the virus, in the healthy population, so people that don't have cancer, in some populations is as high as 35%. And there is a clear gender difference as well, with men having both more common infections, more likely to have an infection, but also more likely to be infected with one of those high-risk HPVs. And it's the HPV risk, high-risk type HPV 16 that is predominantly associated with this cancer. We now know that 40 to 60% of these head and neck cancers, OPSCC, which is oropharyngeal squamous cell carcinoma, a subset of head and neck cancers, are HPV positive. And again, as has already been said to you this evening, these are classically younger individuals. They don't have a history of smoking. They don't have a history of excessive drinking. And HPV 16 is largely responsible for these cancers. What do we have in our toolkit? Well, wonderfully, individuals with HPV positive head and neck cancer are responding much better to treatment for this disease than conventional, if you like, head and neck cancers. So that's great. We've got real opportunities there. We also have the extension of the HPV vaccination program in 2019 to boys as well as girls, completely gender-neutral vaccination program now. And again, that's fantastic. And there are some data coming out now that are suggesting that the vaccine is protective for oral infections as well. But what about the situation now? That's the future, right? What about the situation now? Well, the global burden of these head and neck cancers is around 29,000 cases per year. And individuals present late at clinic. They have generally a lump in their neck, by which time that cancer has already started to spread. So we know that these infections generally establish in the tonsils, or perhaps in the base of the tongue, and that individual presents at clinic with that lump, as I've already said. But actually, we don't know what's happening in this middle bit here. We don't know how that virus is causing head and neck cancer. So that's what, hopefully, we are going to be showing. So to help us understand what that virus is doing, we have a clinical study that collects healthy tonsils. Well, healthy is a bit of a strong word, because those tonsils are coming out for a different reasons. We're not just taking people in off the street and asking for their tonsils. So we've got recurrent tonsillitis perhaps, or maybe they're associated with snoring. But the crucial point is that they are non-cancerous tonsils. And we are looking at those and seeing if the virus is there, and if the virus is there, what the virus is doing. And that is a process called the natural history, what the virus is doing in those tonsils. And this is a cross-section of one of those tonsils, a healthy tissue. And we believe that the virus is establishing in these areas here. This is called a reticulated crypt in our tonsil, and we think that the virus is getting in there and leading to cancer. Interestingly, some of our data is showing that perhaps this isn't the case. One of the markers for the tonsillar crypt, this one here, CK7, is actually, we're not finding it in head and neck cancers. So there are many questions to answer. We just don't know the full picture. With that natural history aspect, we are scrutinising those positive tissues to identify early cellular markers of HPV-mediated disease that could be biomarkers for this disease. So they have the potential then of being targets for treatments and targets for diagnosis for the disease. And this slide gives a kind of overview of our study. We have recruited around 80 patients now across 4 different hospitals. We've donated their tonsils, a lifestyle questionnaire of their behaviours that are known to be risk factors for this disease, and an oral swab. And we combine a number of molecular analyses with histological analyses, and then relate those data back to the lifestyle questionnaire through a multivariate analysis. So we're trying to paint a full picture of what is happening in the head and neck. First of all, we screen those tonsils for HPV with a broad spectrum screen, and here we're reporting a prevalence of 17% in our cohort. So people that don't have any symptoms of head and neck cancer, but are having HPV in 17% of those individuals. Those rates are similar between both men and women, and they're concordant between tonsils of the same individual. But interestingly, if you look at subsections of that tonsil, then we don't see that infection uniformly across the tonsil. So we're taking those positive tissues forward now. And we're looking at what the viral load is, what the viral type is, what the virus is doing in those tonsils. And to inform that work, we have been looking at data sets that are publicly available from other studies. And in those, we are actually finding active infectious virus in 9% of those healthy tissues, with a range of different viral types and different viral late and early genes as well. So we've had a few COVID-related bumps in the road, but that work is now all coming together, and to paint that full picture for us. The most significant, of course, will be those 10 biomarkers of that HPV-mediated disease. We also get out of the lab. We think it's really important, again, as has already been discussed this evening, to be raising awareness of this disease. So this is us, just a couple of weeks ago, with Oracle, with the Swallows Head and Neck Cancer Charity, and with 2 major East Midlands hospitals, Leicester and Derby. And we ran a pop-up clinic in the shopping centre. And we just brought in people that were out shopping that day to talk to them about head and neck cancer. And we also offered them head and neck screens with our clinicians. We screened 81 people and sent 10% of them for further investigation, 1 urgently. I think that's phenomenal. Clearly, we do not know about the symptoms of head and neck cancer, and we are not looking after our oral health. Anecdotally, most people hadn't heard of HPV at all in any context, and those that had did not know that it was a risk factor for head and neck cancer. This is some of their open comments, and we will be using these to start to build the basis for this next part of our work. Interestingly, there's this one here about how to self-screen. We are going to be launching with Oracle later on later on this year, this summer, a video about that self-screening process. And the idea being that individuals can get to know what is normal for them and hopefully get seen quicker than they are at present. So a very whistle-stop tour of the very different but integrated approaches that we are taking to raise awareness of head and neck cancer and to understand what HPV is doing in the head and neck. And we very strongly feel that understanding what the virus is doing is the way to answer these questions. So without further ado, I'd like to thank the people that do the work and fund the work, and the clinicians that support the work. Marianne, my PhD student there on the left-hand side, is here this evening, and she's got a poster at the back as well. So please do go and talk to her.